So the patient we have today is Mrs. Baker, and she is a 54-year-old female who came into the ED complaining of nausea and severe epigastric pain for the past 3 days, and she has a history of osteoarthritis, and she stated that she has been taking 400 milligrams of ibuprofen 3 to 4 times a day because her arthritis has been getting that bad. So I'm going to do a quick QSIN on Mrs. Baker. She has her wrist, we're going to check her wristband. Her name and date of birth are on it. She has her whiteboard up, and the correct staff names and dates are on the whiteboard, and the patient's room number. She does not have any oxygen on, no NG tubes, no chest tubes, no abdominal tubes, no catheter. She does, however, have a right AC saline lock, and there is no redness, swelling, or tenderness present. And her bed is in the lowest position. She has 3 side rails up. There's no obstacles within her way. She has water, a trash can, and she also has her call light within reach. Now I'm going to do a head-to-toe assessment on Mrs. Baker. Hi, Mrs. Baker. My name is Grace, and I'm going to be your nurse today. I'm going to do a quick head-to-toe assessment on you. First, I'm going to wash my hands, apply some gloves. Can you tell me your full name, please? And can you tell me where we're at today? And do you know the date? Alerted and oriented times 3. And I'm going to do some quick vital signs. I'm going to take your temperature. Can you open your mouth up for me? I'm just going to go right under your tongue. That's done. It's 98.7 degrees Fahrenheit. Now I'm going to check her pulse. Her radial pulses are present bilaterally. Her pulse is 85 and it is strong and regular, and I'm going to check her respiratory rate. Her respiratory rate is 18 and it is regular and normal ventilation depth. And I'm going to check her blood pressure on her left arm, and it is 116/76, and her pulse ox is 96%. Skin is pink, warm, and dry. Skin turgor is elastic. And I'm going to listen to your lung sounds. So every time my stethoscope touches you, will you take a deep breath in and out for me? Lung sounds are clear. Her chest is symmetrical. Are you having any cough? No. Okay, no cough. And now I'm going to listen to your heart. Apical pulse for a full minute. Okay. S1 and S2 are present, and it is a strong, regular beat. And I'm going to check out her hands. So, cap refill, and each digit is less than 3 seconds. There's no edema present in her upper extremities. Can you push against my hands? Can you pull against them? And can you squeeze my fingers? She's able to do that. Are you having any numbness or tingling in your fingers? No? Okay, can you wiggle your fingers for me? Awesome, thank you. And are you having any pain anywhere today? In your stomach, in your epigastric region? Okay. And can you rate it on a scale of 0 to 10? An 8? Okay. And can you describe the pain to me? Is it constant? Does it come and go? Okay, it's constant. Is there anything that makes it feel better or worse? Okay. And when did this pain start? 3 days ago? Okay. And does it just stay in your stomach or does it radiate other places? It just stays in your stomach. Okay. And now I'm going to check out your abdomen then, since you said it was bothering you a little. I'm just going to listen to your bowel sounds. Bowel sounds are hyperactive. I'm going to feel your stomach. You let me know if any tenderness. Okay, there's some tenderness right here in her right upper quadrant. Does it make it hurt more when I press on it a little? Okay. No tenderness on this side? Alright. Her abdomen is rounded and firm. She has hyperactive bowel sounds in all 4 quadrants. And are you passing gas and belching? Okay. And do you know your last bowel movement? A couple days ago? Okay, thank you. And are you having any constipation and diarrhea? No. And what about nausea and vomiting? Okay, so you're nauseated. Okay, how long have you been nauseated? Just started today or a couple, like 3 days ago when the stomach pain started? Since the stomach pain? Okay. And are you having any urinary frequency or pain while urinating? No? Okay. I'm going to just check out your feet now. Will you press against my hands? Will you pull back? Alright, I'm going to check your cap refill. Each less than 3 seconds. There's no edema. Any numbness, tingling, or pain in your feet? No? Okay, can you wiggle your toes for me? And can you tell me what toe I'm touching? Okay, good. And check your pedal pulses are present bilaterally. So I'm going to just go let the doctor know about your nausea and everything, and I will be right back. So the doctor wants to administer you 4 milligrams of Zofran into your IV here in your elbow area, and that's going to help with your nausea and hopefully make sure that goes away. So I'm going to go get that ready. First, I'm going to wash my hands, apply some gloves. We already assessed her nausea and vomiting and her abdominal distension for the Zofran. So first I'm going to wipe off the med, and we are going to get 1 milliliter is 4 milligrams. I'm going to get a new alcohol swab and make sure to swab this. And we're going to, make sure the IV is patent, and we're going to first flush it. And then we're going to administer the 1 milliliter of Zofran over 30 seconds. And after that 30 seconds, we're just going to flush again. And we're going to clean the saline mop again, or put one of those little green things on. And we're going to discard everything into the sharps container. And I'm going to leave Mrs. Baker in the bed in the lowest position, and 3 side rails up, her call light within reach, and I'm going to come check on her in half an hour to an hour or so to make sure to assess her nausea again and to see if the Zofran has helped. And then I'm going to throw everything away in the sharps container and wash my hands. And then to report off to the nurse, the next nurse, Mrs. Baker is a 54-year-old female who came into the ED complaining of nausea and severe epigastric pain for the past 3 days. She reported a history of osteoarthritis, and she has been taking 400 milligrams ibuprofen 3 to 4 times a day regularly for the last few months. Assessment showed hyperactive bowel sounds with tenderness over the right upper quadrant. Later that day, she had approximately 300 milliliters of coffee ground emesis, indicating bleeding in the GI tract. I then administered 4 milligrams of Zofran via IV push, and her fecal occult test came back positive, and her CBC showed a hemoglobin level of 10 grams and a hematocrit of 31%. I then inserted an NG tube and put it on low intermediate wall suction to let her stomach decompress, and later on her blood pressure dropped to 96/60, and her suction canister was full of bright red blood. She became pale, diaphoretic, drowsy, and her heart rate went up to 122. She had 2 units of packed red blood cells, and a stat EGD was performed, and it confirmed 2 slow bleeding gastric ulcers, which they cauterized, and 1 arterial bleed, which they also repaired. And she is now here for observation post-op and seems to be recovering well. So at this time, we just need to make sure she maintains an airway, her medications and IV fluids are being administered as ordered, and that we are promoting healing for her, like deep cough and breathing, incentive thermometer, and teaching to prevent any further ulcers in the future.